Idea on how many lives they've saved?
I would say hundreds, if not thousands of lives.
Really?
Yeah.
That many?
Yeah.
Good evening. We are talking about fentanyl, and that is how many lives have been saved, but fentanyl has claimed hundreds, if not thousands of lives here in Canada. Now, hoping to stop that epidemic from hitting their establishments, bars in Kensington Market are now training their staff on how to spot overdoses and possibly save lives by administering Naloxone, an opiate antidote.
I think it's the responsible thing to do as a bar owner, and offering a place where people hang out where there's alcohol consumed. You know, in an environment like that, it's the responsible thing to do is to learn everything that we can about how we can keep our customers safe.
Sean Creamer and several of his staff from the Dakota Tavern were among the 50 or so servers and bartenders who turned out of the boat in Kensington Market to learn more about fentanyl and its dangers. Others, like Tristan Joseph, who works at Cheapo Wine Bar, came on their own time.
I actually heard about it last minute, and I thought it was just kind of a cool thing to know about, because like I know people who do drugs, and it'd be just nice to be calm in a situation where the unfortunate happens.
Tonight's training session was organized by Johnny Trelawny from the Boat and Trinity Comment. He fears it's only a matter of time before the street drug, which can be lethal in minute doses, ends up cut with drugs often used on the club scene.
Well, what I think it'll give us is an education on how to recognize when someone's high and what they're high on, and the ability to treat them when they do hit an overdose state.
No one really expects an overdose when it happens.
Kier Martin is with the Queen West Community Health Center and one of the speakers tonight. He says it used to require a needle to administer Naloxone, the antidote, but no longer, making it virtually bulletproof.
These are the new nasal Naloxone kits that are coming out now. You can't overdose on Naloxone. You can't give a person too much Naloxone. It just reverses an opiate overdose. If it's not an opiate, it's not going to have any other effects.
Martin says the idea is anyone can administer the nasal spray, and you don't need medical training. It's simply to keep the person alive until the proper help arrives. While the nasal injectors are new to Toronto, they are used in BC and south of the border by police and other emergency personnel. Martin figures they have saved hundreds, if not thousands, of lives with it.
Should this be mandatory in bars?
I think the training is so simple that it should be in bars. It should be in doctors' offices, that anyone that's prescribed opiates